back in September, we talked with Dr. Amy Perlman, a urologist and men's health specialist here at Iowa. And I'll post a link to that show. I did post a video on our YouTube channel of that conversation. And some men have been expressing their concerns about seeing a woman urologist there. And I'd like to hear your responses to some of these comments. So we'll start with this one. One person commented, "Too embarrassing to go to a female urologist. Wonder how many men in the same situation are unable, through embarrassment of their bodies, afraid to seek medical treatment. Please address this issue if possible." Happy to do that. What do you guys think about this problem?
I think it's a valid concern. Like, I think you have the right to choose what kind of provider you want to see based on your level of comfort. I think that's a common sentiment that we hear about with like women and male gynecologists, is that women are uncomfortable receiving care from a male gynecologist. However, I think that a lot of those issues are gonna come up in other specialties too. Like in primary care, you're going to talk about sexual dysfunction. You're going to talk about sensitive issues in specialties like that, where you're going to encounter men and women as your physicians. So I think that it's not unique to urology. Mm-hmm. But I definitely understand the concern.
So the problem I have with this specific comment is not, so they first talk about like, I would be too embarrassed to see a female urologist, which is, I think, I get that. I understand that sentiment of I would rather see a female gynecologist personally. But then I don't like that second half of the comment where it's like wondering about how many men are too embarrassed to seek care, as if the existence of a female urologist treating men's health is like a barrier to all men seeking urology care, or kind of like implying that the fact that she's a urologist means that like men can't seek any care from like UIHC urology or something. At least that's how I was hearing that. And that's what kind of bothered me about the comment, is that it's like, that's a completely separate issue. Like, are you embarrassed receiving like care for a female? Or are you embarrassed receiving all medical urology care?
Well, it's worth thinking about, because I think among the problems that people have in seeking care, especially, of course, men have this idea that, or may have this idea that seeking help for my problems is a weakness in some way. You know, that's unfortunate, because you're going to need to establish a relationship with a medical provider in order for you to stay healthy as long as you can until you're a cranky old man. Yeah. Like me. Yeah. So.
Yeah. I have an issue with calling this a problem at all, because isn't urology like a male dominated specialty?
Yeah.
So if you don't want to see a female urologist, go to a male. Yeah. So why is this person concerned about the number of people who don't want to see a female urologist? There's far fewer of them.
Well, I think if you go back and listen to the video, or listen to the show episode, Amy spent a lot of time. We spent some time talking about what it's like to be a female urologist in an A, male dominated specialty, and B, a specialty that seems mostly interested in catering to men's urogenital tract. That's probably what this person was reacting to.
I guess I just didn't really take the comment as seeing it as a problem. I guess I just took the comment as, I don't think I would want to see a female urologist being
fair
a man.
enough.
Yeah.
And I think that's perfectly valid.
Yeah. I think I like the first half of the comment. I took that. The second half is what kind of made me, was like wondering how many men are like too embarrassed to seek care. And that was where I was kind of like, are you saying that there are men who just like shouldn't go at all to see any of the urologists at the UIHC because there's one female? But we don't know what this person intended. Like, maybe they weren't totally intending it how Maddie was seeing it, and Emma and I are like reading into it more than we should. I don't know.
Another person would never see a female about an intimate male issue. While I'm sure she could learn about the physical, there's absolutely no way on earth she could ever begin to understand all the psychological, ego, and self-esteem issues behind discussing, looking at, touching, rectal exam, erectile dysfunction, male issues, discussing this stuff with an attractive younger female. Simply no way she could understand about a man's sense of masculinity, how men view themselves, how we feel, the crushing societal pressures and expectations. Oof. Wow.
Yeah, that was a lot.
That is a comment.
I think that while a doctor is never going, like in any field anywhere, you're never going to only encounter things that you easily can understand. And this kind of goes back to what we were just saying about trying to gain experiences to broaden your understanding, to like increase your ability to empathize. But like even no matter how much of that you do, like those experiences only go so far. There's only so much you can understand, and there isn't a field where you like are only like where you're going to be shielded from that. And I'm sure that this commenter has even had to talk to their doctor about other problems that doctor like probably can't personally identify with, but that doesn't mean they can't empathize and they can't treat them. But I think some of the content of that comment about like crushing societal weight and stuff, that just, it makes me sad that it feels like this person actually might need some mental health care, that as much as a urologist should be providing empathy and social support and things, like there's only so much they can do to help in just the way the structure of the appointment works. Like there's just,
let's think about, let's spend a minute thinking about what a urologist or any physician can do to offer their patients some security and some, I don't know, some sense of security that seeing somebody different from them is okay.
Yeah.
Is there, can you, how would you approach a patient, I guess, is what I'm asking, who happens to say to you, I don't really feel comfortable seeing you, but I'm going to see you. What might you say to that person, do you think?
I guess I'd want to why, like ask like more into like, why don't you feel comfortable? And like, what don't you think I understand? Just like trying to hear from them and trying to learn that experience that they've had that I haven't, that is like causing that disconnect, and also just try and provide some assurance that like I'm probably not going to be able to understand, but I will do my very best to empathize and to not let that lack of understanding like impair the care I provide, and that I hope that they will tell me if, hey, you're way off on this assumption or something, that I welcome that feedback.
Well, I think about this question in a not necessarily just say you're at the urology clinic, but say you're at like a primary care clinic. There's no way that the physician or whoever's there, the practitioner, has seen every single case that's walked through that door, but yet they're still able to treat them. Just because they've never experienced this one condition doesn't mean there's, I think sometimes people forget that they're still experts in this field. And even though they might not have the exact same experiences with you, they've studied it just as much as their colleagues that might come from a little different place and whatnot. And that's something to, reminder just globally, in medicine, and you're not going to have everything be perfect, but they're still experts and they're still able to help in these situations.
Yeah, I feel like even though I may not have experienced the specific urologic condition that they have, if it's painful, I've experienced pain before. Maybe it's not the exact same kind of pain, but I've experienced pain before, and I may be able to empathize in that way. But going back to what Abby was saying, I think also when talking to them, like saying something like, if I'm not understanding something, and if you think I'm not understanding, maybe I can consult a colleague, or maybe like even saying that they can see someone else. They're welcome to see someone else. It won't hurt my feelings. You won't burn any bridges. And this other person, and I could even refer you to somebody or find someone who I think you might fit better with. So just giving them options too.
Yeah, I think also maybe just explaining to them that a good doctor spends a lot of energy and effort on understanding and empathizing and being as sensitive to the needs of my patient, even in non-medical, even when in areas that you might consider non-medical, and so that is my goal always when seeing patients and when treating patients. I think that might go some way towards reassuring somebody that you understand and that it's a lifelong process. There will always be situations that I need to learn more about, and that is how my life works. I'm going to continue learning about things through your help. We are partners. Another comment that I found interesting. Urologists need to set up their offices like mammogram clinics where men can be seen to by men. There are no males involved in these clinics. Women hate to go, but still go because they are treated by women. As a male, I would like to be treated by a man and with the aid of a male nurse. I can see how that might be true.
Mm-hmm.
I think that might be an accident of...
Yeah, I was like, is that true? I feel like...
I don't really know. If it is true, it's perhaps an accident of the kinds of gender roles that exist in medicine.
Yeah.
There are more female nurses, I think, than there are male nurses, for instance. But I don't know.
Yeah, I would say, I definitely understand that desire. I doubt that there are enough male nurses to make that a reality.
Yeah.
And I feel like, I don't know, there are so many urological conditions that can happen to men and women.
Yeah.
I think that the common urological issues that we might think about, like sexual dysfunction or urinary dysfunction, seem more like male problems. But I think that having women in urology is really important because everybody has a urinogenital system, every single person. So there's a urologist out there for everybody. And I think that you as a patient should see somebody who you're more comfortable seeing, because that can be a really big barrier in a patient-doctor relationship if you're not comfortable with whoever's seeing you. And that's really important. And you need to do that for yourself. But like some of these comments, and I think what we might be getting in the room is like, women shouldn't, there isn't a place for women in urology, when I think that's just like fundamentally not true, because there's a lot of diseases that women are going to have to see a urologist, and they may be more comfortable seeing a female urologist, for example.
Mm-hmm.
Also,
I feel like that was a tangent, but
yeah. Also, I think there's an assumption that women can't be embarrassed in the same way as men about urogenital conditions.
Yeah, that's a good point.
Yeah.
Simply because they don't have, the same dangly bits that men do. When in fact, that's not at all the case. There's plenty of conditions that women, unfortunately, I think find embarrassing to talk about with their with their gynecologists.
Mm-hmm.
Maybe you can help me think of some, or what they would be called off the top of my head. I'm having trouble.
I did a month of urogynecology, which is a combination of gynecology and urology. And I think there was far fewer, like barely any patients who didn't say they were embarrassed to talk about what we were about to talk about. Like they were embarrassed to talk about their like stooling habits and urinating and using pads and like all these things they didn't want to tell me. And I was like, no, it's okay. This is what I'm talking about all day. This is what you're here for. Make me uncomfortable at all. And so you really have to encourage them. So I don't think this is like a male issue at all.
And women have problems achieving orgasm. They have problems with infections. They have all the same
urinary dysfunction after pregnancy. Yeah, that's such a good point. Going to the doctor is very vulnerable.
Yeah.
It doesn't really matter what specialty you're in. There's a lot of really sensitive medical issues. So
I think that's what it comes down to, is remembering the vulnerability that your patients are showing just by coming to you.
Right.
And then displaying that you understand.
Yeah.
Mm-hmm. Yeah, because like, when do people go see a physician? They're not seeing them when things are going well. They're going to see them typically at a lower point in their life, and just remembering that.
Yeah.
Yeah, this is actually really good to think about. It's not specific to these really sensitive specialties like urology and gynecology, and anybody coming to see a doctor is really trusting you. So I think it's important to.
Well, if we can mind Jacob's life, you mentioned that when you were a little kid, you had this problem. Yeah. What was do you want to talk about the diagnosis?
Oh yeah, I have no issue talking about it. So it was called molluscum. Basically, I know that from being a parent. So basically, for those of you who aren't familiar, congratulations. But I was covered in like warts, on my face. Yeah. And as a first grader, being covered in a highly visible thing, and when people are afraid of cooties, this is very detrimental. It's very it was very challenging to make friends. It was very challenging to be included in things. Definitely being an outsider with that was very hard. And so when I saw, when I received care, it was incredible having this experience, not just being treated for like my skin, but also, being treated like mentally and like emotionally and socially again. It is being seen as like this whole human being being bettered in all these facets of life, which just unbelievable. And I was very thankful, and I thought about this quite a bit since making my decision to enter medicine, that one moment.
Shortcoats, if you're enjoying our conversation today, I'd be grateful if you'd let people know by posting a story on Instagram or Facebook or tweeting about us. And don't forget to tag us in your post.
Thank you.
I like this commenter who objected to the ubiquitous models and posters of male reproductive organs all over the place, saying that in the event something needs to be explained, they could just be brought out. They don't have to be every freaking where in the doctor's office. So maybe in the meantime, just keep them in the closet or something. I don't need to be seen everywhere during my appointment. What do we think of this?
I think that's a really great point that is actually super able to be extrapolated to way more than urology.
Yeah.
I think
I have never been in a doctor's office that didn't feature a large poster that could be considered kind of gross.
Yeah. Well,
by your average person,
even beyond the gross posters, I think we spend very little thinking about what can we do to make this experience less negative. And I think thinking about what kind of could we arrange the clinic room differently? Could we put some art on the wall instead of a gross medical poster? What could we do to make this less of a thing? And I think in pediatrics, that's actually something that is super common and still done very imperfectly. But I mean, if you think about it, the children's hospitals are always designed very thoughtfully and with art, and how can we make this a less traumatic experience? And I just think that doesn't get translated well into the adult world in any sense of it's suddenly you turn 18 and you're no longer
you're supposed
allowed to be traumatized by your healthcare.
And it's little things too, just making things just a little bit more attractive or making things a little bit less repulsive.
It's a very sterile environment.
Yeah,
for sure. Yeah, one thing that I really liked when I was in undergrad here, I worked in the library at the hospital. And there was 2 locations, one in the children's hospital, one in the adult hospital. And it was really fun because in the children's hospital, I would try to make it fun. I'd wear fun shirts, dress up. I would always carry around origami figures that I'd hand out to children. It was always fun, going around, giving out free books, all this really fun stuff. And unfortunately, it was a lot harder to translate that in the general hospital. There's not as much interest, but it's just so much more, like you said, sterile and just gray and all this stuff that fortunately you get to see that in the children's hospital, but it's very different atmosphere in the general hospital. And
it's also hard for a big hospital to be I'm gonna make this environment as so beautiful that there's.
It's hard, but it doesn't mean that there isn't small things that can't be done, or even just I just feel sometimes the attitude in general of in the children's hospital is we're going to try and minimize the trauma of this. Whereas in the adult hospital, it's this is going to happen to you, suck it up. Mm-hmm. And I just feel it doesn't have to be that way, that why don't we have adult life specialists? Almost every kid who is in the hospital for more than 2 days is going to have a child life specialist come in and try and figure out what can I do to make this hospital stay a little less horrible for you. And I just think that need doesn't disappear when you become an adult. And obviously adults don't want Disney movies and goofiness in the same way a 4-year-old is going to respond to that. But I think that this is important, that hospitals and doctors are scary and traumatic and not a fun place to be, but that doesn't mean we have to just accept that and be there's nothing at all we can do to not minimize.
I'm trying to imagine what the thing that you could do is.
I feel I have a really good idea. As a trainee, especially, and as a medical student, you have more time than any other person on the team. So I think that's a great idea, Abby. Exactly what you said. Go into a patient's room when you have downtime, and is there anything that I can do for you? Just sitting there and talking to somebody. Is there anything I can do to make you more comfortable? Is there anything I can do to make you feel a little bit better? I feel that's a really good opportunity to use that downtime and see if there is any need that your patient has. I know a lot of patients or stories that you hear on the wards of attendings will be oh yeah, this patient loves they love to be with medical students. They know the medical student more than they know me.
Yeah.
I think that's a really good opportunity for trainees.
Yeah, I think there's plenty of opportunities. That's a really good one, Maddie. But for example, I volunteered at both the more adult and then like kid side of the hospital here, I really enjoyed it at the kid side of the hospital. You can go and play games with them, watch movies with them, you can have fun with them like the child life specialist does. But then when I was here in the adult hospital, and what I've heard from a lot of my peers is it's a lot of the same thing, where they're doing things like cleaning wheelchairs, they're doing things like sitting at a desk. While these are important, there's so many people that are willing to come in. You know, they have to turn down people every year to volunteer here. Use some of those people. You can use your volunteers. Go in and ask them how their days are doing. Provide fun activities for them to do. It is, yes, a less scary, less traumatic experience. I think that's super important, because if you're having a bad time in the hospital, why would you want to come back? And then you're delaying care and all these other things.
So many of the things that adults like, though, are bad for them.
Cards.
Fair.
There should be a deck of cards in every hospital.
Like Child Life will provide like procedural support. So you have someone who is like trained of like, this procedure is going to happen in this child, and you have this person who is trained on how to comfort the child through the procedure.
Love it.
But adults still, I like can think of so many times, like I had a lumbar puncture once, and like I'm like still afraid of like getting any kind of injection because of how horrible this lumbar puncture was and how scary and bad it was. And you know, it wouldn't have not been at all scary and not at all painful. But I think about if I had someone in that room whose whole job was to hold my hand, look me in the eye, and talk me through it, I think that it would have gone dramatically different. Like it still wouldn't have been a fun time, but I think that would have been enough that like I wouldn't be like so freaked out and traumatized by what happened to me. And I just like, and like you said, like it's a small thing. Like I just wanted someone to hold my hand and tell me like, you're doing a good job. But like the operator of that procedure, like the doctor was so like, they had to do the procedure. It wasn't for like a lack of like he felt really bad for how horribly this was going. Sometimes but he couldn't do anything because he had to get it done. Yeah. And so
I had that experience in a different way where there was somebody there to like hold my hand when I was getting my IUD placed. And if you've never had an IUD placed, it hurts really bad.
I haven't.
And the medical assistant stayed in the room, and he just stood next to me while the PA and the physician were doing the procedure. And he was talking to me the whole time. And when he could tell that I just needed to like take a couple breaths, he like talked me through it. And like having that person, that support person to be there, like when he could tell that I was really in pain, to like even just put a hand on my shoulder was really helpful. So I totally agree that there should be that support for adults in the hospital.
Yeah. And
make it look like a hamburger joint. That would work for me.
I kind of laughed when I heard this question because I'm going to be an OBGYN, and I don't know if you guys have noticed, but OBGYNs are kind of like obsessed with uteruses and like
I have noticed that.
I'm applying to residency, and programs will send you little gifts in the mail. So like I have a little uterus pin and a lanyard and a sticker that they sent me. So I think it's funny. Like on one hand, I want to like destigmatize like talking about, you know, some of these more taboo topics, but I kind of agree with the commenter that like we don't have to have huge anatomical diagrams on the walls. We could have like pretty art and bring out the diagrams when we need to. But I just thought it's funny because my mind automatically went to all the uteruses.
I think it's such a good point, Emma.
I think it must be I'm sure it's an effort to educate people. Yeah. Like these are your bits. Yeah. These are the parts of you.
Yeah.
Maybe you're interested in it.
Yeah. And
maybe a lot of people are.
I got super like off topic and we really got on my soapbox here, but I think it's just like this is the point of like this is like this listener brought up such a good point that it's like we don't always think about how is what we're doing affecting the patient experience. And I can totally see how if you're like already embarrassed about being at the doctor for your genitalia and you're in a room just surrounded by detailed large anatomic like I can totally, now that I think about it, see how that would make me feel. And I just think that's a good reminder for us to think about in every way, whether that be how we're decorating the space.
Oh wow, a cross section of a penis.
Like totally.
That's
not
what
making,
I want to
like
look
I can
at.
definitely see how that would have the opposite effect of what you're wanting. So
what a lovely conversation.
I know.
If you agree, listeners, write to us.
Yeah. I just wanted to say, I feel like sometimes I was harsh to the male commentators. I want to say it's okay if you can't get past the female and you need a male urologist. That is 100% okay and fine. And I understand that. I think I like would rather see a female gynecologist. So that's not what I'm saying. I think my biggest thing that got me kind of spicy to date was that I just didn't like the implication that there wasn't any space for her to treat men at all, and that because she was a female, she was unable to do that empathy. And so I just wanted to make that really clear for our listeners.
That is what empathy is all about. Yeah. Seeing things from the point of view of another.
Yeah.
And that's what we're trying to teach students to do. And that's what hopefully, I mean, it is a problem in medicine in that the trajectory of empathy, the trend of empathy is downward from the beginning of medical school through training. And, you know, that's definitely something that a good physician and physician trainee keeps track of and understands and pays attention to in their own professional lives.
Yeah. And as a qualifier to my statements as well, I totally agree with Abby. Dr. Perlman is incredible, more than capable of treating all the men that she treats. And I actually am interested in urology too. So as a future potentially female urologist, I want to say that I would also obviously hope that many men are comfortable receiving my care. And, you know, I'm not saying that you should only be seen by the type of, you know, by the same gender doctor. But I understand the sentiment of wanting that and the comfort that comes with that. So just as, you know, qualifier.
Yeah.
Well, there you go. That is our show. Emma, Maddie, Abby, Jacob, thank you for joining me on the show today with me. I appreciate it.
Thanks for having us.
You're welcome.
You're welcome.
And what kind of obscene plastic model of a reproductive organ would I be if I didn't thank you, Shortcoats, for making us a part of your week? If you're new here and you like what you heard today, follow the show wherever fine podcasts are available, like Spotify, Apple Podcasts, Google Podcasts, and as I said, YouTube, when I remember to click the button. Our editors are Maddie Walleen and Nick Lind. The show is made possible by a generous donation by Carver College Medicine Student Government and ongoing support from the Writing and Humanities program. Our music is by Dr. Vox and Catmosphere. I'm Dave Etler, saying don't let the bastards get you down. Talk to you in 1 week.